Good day, everyone. This is Dr. Shaista Sariwal from the Nts Hospital, Singapore. I'm working as a specialist obstetric and gynecologist and cosmetic gynecologist in Nts Hospital, Singapore. Welcome to everyone to participate today. Our topic is the first trimester of the pregnancy or new beginning. So we will start our topic. What was important to discuss about this topic, like definition of the first trimester, prenatal visits, prenatal exercise, nutrition, diet, handling of discomforts, what you have to do and what you don't do it in the first 3 months of the pregnancy. There is some kind of the mental and emotional health disorders and managing the high risk pregnancy, medication in the pregnancy in the first trimester. So what is the first trimester in the pregnancy? We divide we have like 3 trimester in the pregnancy, like first trimester, second trimester, and third trimester. In the first trimester of the pregnancy, we are starting like from the like your last period day, first day of your last period day until the 12th week of the pregnancy. So that means this is counting like a 3 months. Okay, so this is called the first trimester of the pregnancy. So this time we had to talk about only the first trimester. This is very, very important for you and for us. So this is the time of the great anticipation and the rapid changing for the growth for yourself and for your baby. So your first prenatal visit, what is important for you and for the doctors? So we had to start, because this is like a detailed consultation when the patient is coming to us, and we had to ask more detailed histories. For example, we had to ask them the personal medical history. So what is important in the personal medical history? For example, they have a high risk, like for example, they have a sugar in the pregnancy, we call diabetic, they have a high blood pressure, like hypertension, or they have like anemia, low hemoglobin, or sickle cell disease, or thalassemia, or other disorders. For the previous and current medical condition, for example, they are taking any medications, for example, you are taking multivitamin, it's prescribed from your doctors, or you are taking any folic acid, or and there are other kind of the multivitamins you're taking by yourself, or the different kind of the medication that you don't know is safe in the pregnancy or not. Previous surgeries is very important for us. For example, we have to ask the patient whether you have a previous deliveries or is it the first pregnancy. If you have a previous deliveries, we have to ask the patient is there is a normal delivery or you have a surgical delivery, for example, cesarean section. So depend on the history as well. We have to decide our future planning for the delivery of the patients. Some patients, they have a repeated misabortion. They are coming to us giving the history, so we have to ask them they did the spontaneous abortion or they have a DNC done in the previous years. Other conditions, there are the different kind of the medical history, the surgical history, like they have abdominal surgery, like sleeve surgery, they have open surgery, abdomen or pelvic, or in the laparoscopic surgeries. Maternal and paternal family history is very important. For example, we have to ask the patients like they have illness, intellectual or developmental disabilities in the family history, or genetic disorders in the family, or for example, like sickle cell disease, Tay-Sachs disease, any baby that have a previous history in the family, like brother or sister, or any auntie families that have like Down syndrome of the baby, or they have a previous baby like diagnosed with a Down syndrome or other kind of the syndromes. The personal gynecological and obstetric history is very important. For example, when we said like before, when patients are giving the history, they have stillbirth. That means they have premature deliveries, like after any abortion, like 20 weeks, or after the after the 20 weeks, like for example, premature after the 28 weeks or 30 weeks before the 35 weeks. If they have any previous premature deliveries, what was the cause of the previous premature delivery? Maybe the rupture of the membrane. Maybe any kind of the infections they have, like baby have a chest infection, or mother, she have a repeated urinary tract infection or vaginal infection. Because it's not treated by any medication during her consultation, during her checkup in the antenatal. So these kind of the infection, they can make the stillbirth baby or other kind of problems. Miscarriage, many women, they're coming to us like they ask me, they have repeated miscarriages, like 2 or 3 before, and they are very important for us to be treat with this patient in the first trimester, because this is very, very important for them. There are chances again miscarriages or with the repeated like the weeks. So deliveries, this is very important. When we ask the patient, you have previous baby like normal deliveries, if there is any complication during the deliveries or after the deliveries, any adhesion of the placenta, or maybe they check them remove the placenta after the delivery in the general anesthesia, they go for the operation theater, they remove by manually or with the medication or different kind of the extreme in the miscarriages or deliveries. Termination, termination is not allowed in the Bahrain, but many patients when they coming from the different countries with termination not means like abortion by themselves, but medical termination is there. Some baby when they have different kind of the condition abnormalities, they're diagnosed in the first 3 months, so they go to their own country and they terminate. So this is very important for us. We have to be checked with the previous like discharge summary or any medical termination notes or anything. We have to be ruled out about the cause of the terminations. Menstrual history is very important. In the early 3 months, we have to ask the patients when you have a regular cycle or your cycle is irregular. So easy for us to diagnose. For example, they are giving us they said we have last month 2 days just spotting or 2 days a normal bleeding and then the spotting. So we have to do calculate the weeks of the pregnancy according to the menstrual duration and the cycle. Any past delivery complication, like as I said, the retained placenta or other complication like a DNC, so this is a more important for us to have to rule out. Education is very important. When the patient they have discussed about regarding the importance of the proper nutrition and then expected weight gain, how much the weight they're gaining in the pregnancy. This is very common question. We are receiving regular exercise. So we have to discuss later on about this or the condition like they have to want different kind of the drug or medication or alcohol or tobacco during the pregnancy or there is maybe the discussion for concern about the domestic violence. Blood test is very important, very, very important in the first trimester. When we see the patient, they are already giving us the different kind of the blood tests, but most commonly we have to do all the screen tests. They include like blood pressure, hepatitis B, hepatitis C, rubella is very important, HIV, VGRL, and then there's many other blood tests. We have to go to the CBC and then HIV, VGRL, J6PD, thalassemia. These all the things is very important for us. We have to know in the first trimester of the pregnancy. Need a screening test. Yes, this is another important blood test. In the first 3 months, we have to advise the patient for the markers test or the nifty test. This will later on discuss in this presentation. This includes with the genetic test. What do you do the next? For example, you confirm your pregnancy. You came with the urine pregnancy test positive. Okay. Sometimes when we see the urine pregnancy test, when they bring the skip test, one line is very clear and one line is very light. So we have to advise them to go for the blood pregnancy test. Like this will be the beta HCG is more reliable than the urine pregnancy test. So we have to go with a step by step. Like for example, we have to diagnose with a different way. As I said, the beta HCG quantitative is more reliable and more easy for us to be diagnosed with the ultrasound finding and with the beta HCG. The ultrasound scan either pelvis or TVS, like transvaginal ultrasound. In the first trimester, the transvaginal ultrasound is safe in the pregnancy. Many patients, they are scared. They said maybe we'll do the transvaginal ultrasound and maybe the baby can abort. No, it's not like that. We are not inserting this transvaginal probe inside the uterus or the uterine cavity. We are just away from the uterine cavity. We call the vaginal area. So we have to insert into that area, and this is very safe during the pregnancy. To easy for us when we not see the 5 weeks pregnancy or the gestation sake in the early few weeks. We cannot see by the pelvic skin like in the abdominal area. So we have to advise them to go for the transvaginal scan. Is more practically and more reliable. Once the doctor confirms, you are the intrauterine pregnancy, for example, we have to do the ultrasound and we have to sure again the pregnancy is inside the uterus. It is very important for us to see when we have the first month of the pregnancy. The first 3 months of the pregnancy, and then we have to go for the routine screening test after the confirmation of the viable pregnancy. Like in early scan, might be there is no fetal heartbeat. Yes, so many times we saw when we see the the gestational sac we can find only in the 5 weeks or 6 weeks. So we can advise the patient always you have to come back after 1 week to reassure again to see the size of the gestational sac and the fetal heartbeat is positive or not. In case, for example, in the 6 weeks of the pregnancy, we cannot we cannot see the proper fetal heartbeat, so we have to give them a time. And then we have to tell them you have to come back after 1 week. So we have to do the one more ultrasound to reassure again for the fetal heartbeat very clearly, and we have to reassure from to the patient as well. So what's important to see in the early ultrasound? This is very important for us and for you. For example, the gestational sac should be the entire time. As I said, this is like your uterus when we see in the ultrasound, either in the pelvis or the transvaginal scan. So we have to see first confirmation for us. We have to go with the to see the gestational sac. It should be in the intrauterine. As you know, the ectopic pregnancy also is very common, so we have to be reassured by the scan, and we have to see very nice gestational sac. We have to see one more like a sac is inside. We call yolk sac. This is the should be present during the first 3 months in the pregnancy, and then we have to see the small tiny like a line here. We call this is your starting to develop your baby size, and then we have to count like we call the crown on plate like CRL. So we have to see the size of the baby and the size of the sac and gestational sac, and we have to reassure both sides with the pregnancy confirmation about the how many weeks they are present. Yes, as I said, like we have to go with the fetal heartbeat, if they're present or not present. Very important to check for us, like we said, hematoma. Many patients, when they're complaining in the first 3 months or first few weeks in the early pregnancy, they say we have a brownish spotting, we have a fresh blood, or we have a bleeding disorders, like in the early pregnancy, fresh blood is coming out with the pen. So we have to, when we do the ultrasound, we have to reassure again the hematoma if there is a subchorionic hematoma present or no, and then we have to give them some medication to with the healthy baby to complete this the filling up, like for example there is a hematoma. So we have to reassure again which kind of the hematoma she has. Is a subchorionic hematoma, like with the near the gestational sac or away from the gestational sac. Uterine fibroid, yes, many patients coming with us like multiple uterine fibroid. We have to see if there is a single fibroid or multiple fibroids, and we have to check the size and size. For example, we have to see the size, how much the big size the fibroid is present in the uterine cavity, and which area is present. Because many patients, when they prefer to go for the normal delivery, and then cervical area, like near the cervix, there is a big fibroid is there. So we will be in the future there, for example, for the delivery time, they will obstruct the area to engage the head, or maybe will not help to progress during the labor time. So there is different condition of the different fibroid is present in the uterine cavity. So we have to do that, and every ultrasound we have to check. For example, every month when we do the ultrasound, we have to check the fibroid size. Is it increasing or is it the same size? Cervical length is very important for us. We have to see in the 3 months, we have to check with the cervical length. We have to check its normal length, it should be 3 centimeters. If in case it's less than, for example, 2.5 or 2 centi, of course, we have to go for the cervical circular. We have to advise the patients. And other options, for example, if there's a cervical length is coming like 2.5 or above, so we have to wait if they don't have any pain or any complaints. So we don't need further cervical circulars. But if it's 3 centimeters, this is a normal one. Right and left ovary is very important for us to see. When we do that, we have to check there is any cyst or different kind of a cyst we can find during the pregnancy. The one most common is the corpus luteum. It's a hormonal cyst. This is a fine. This will go after the 8 to 9 weeks or 10 weeks. Most of this will disappear. But in case if already is the big size of the cyst, we have to follow with each and every time of the ultrasound. Different kind of, as I said, different kind of the ovarian cyst, if there is a dermoid, endometriosis cyst, or the other kind of the cyst, so we have to follow up, and it will be not harm for the pregnancy because we already pregnant. Doctor of the uterine artery is very important, especially for me, because I do all my first 3 months of the pregnancy, during the pregnancy of my patients. I have to do the uterine artery. This is not inside the uterus, this will be outside of the face of the uterine area. So we have to see the blood flow, how the intramammary blood flow is going to the uterus. If there is a chance for the pre-eclampsia, so we can diagnose in the early stage. Yes, we have to go for the multiple and single pregnancy. When we do the ultrasound, we have to check if there is a single sac or there is a double sac. We can see there is a twin or triplet. We have to do in the first 3 months very easily. And the fact, as I said, the fetal heartbeat is very important until the 7 to 8 weeks should be seen in the ultrasound. This is very important slide. I just want to share with everyone. This is we call the translucency ultrasound. This ultrasound we are doing on 11 to 13 weeks of the pregnancy. This scan I do routinely for my own patients, either they have previous any history for the Down syndrome or any abnormality of the genetic disorders, or in the family history, or the normal patients. Advanced maternal age, if there is a more than 35 years of the age, you should go for the Nts Scan, especially 11 to 13 weeks of the pregnancy. And this is we have to see the nasal bone as well, and we have to see the Nts Scan from the fold, from the back of the neck. And it's very common to check with the the screening test, like when we say this test measure the size of the clear tissue called the neck translucency at the back of your belly. Too much clear space can indicate the Down syndrome or might show another chromosomal abnormalities like Paternal syndrome or Rett syndrome. So Nts Scan we are doing in the 11 to 13 weeks plus 6 days. So this is, as I said, like this is the fluid inside. This is the normal one, and if you can see the abnormal one here, and there is no nasal bone. You cannot find the nasal bone here, and we can see very clear nasal bone here. Another genetic markers, like when we see, most probably when we see, like as I said in this slide, when we find like this scan, maybe they don't have a nasal bone. And then the NT is noise size like more than 3 mm the size. So we have to advise the patient if she has the chances for the Down syndrome. So we have to go for the nifty test. There is in the market, the many doctors, they prefer to go for the double marker or triple marker. For myself, I don't rely on this test. I just advise them to go for the advanced test like the nifty test. This is more reliable. And then this is, for example, is safe, non-invasive, and with no risk of the miscarriage to do it, because this is like a mother blood test we are doing. And then this is like offering to screen for the certain genetic disorders, like early week in the 10 or 10 weeks of after the 10 weeks of the pregnancy, we can do it. You can see your baby's sex as well, gender. I mean, there is a male or female baby, and then there is many advantages to do this one, and safe and accurate, simple and trusted. Accurate means this is a 99% sensitivity for the detection of the trisomy condition like Down syndrome. Simple is a test for the small 10 ml of the maternal blood they're taking, and they're doing with the for the check for the nifty test. Trusted over like 9,400, 9,400,000 tests doing each conducting with the worldwide every year. The symptoms, this is very important and very common symptoms when we see the patients when they have like morning sickness, nausea, vomiting, heartburn, acidity due to the too much nausea, and they are dehydrated, they're starting the headache because they are not taking the inject fluids too much, and then mood swing is very common. So we have to advise the patient always try to adjust their mood swings with the environment, and then to make a relax herself. Lower abdominal pain is very common. Yes, many patients when they have an early pregnancy, they have a UTI like urinary tract infection or the vaginal discharge or other condition. So we have to do the lower abdominal rule out with the ultrasound. Mild spotting, this is also many patients that are coming to us and they are saying they have mild spotting or brownish spotting or fresh blood. Yes, we have to be ruled out with the ultrasound. As I said, many patients when they have coming with the spotting, sometimes it's normal because of the they have normal spotting. That means they have we have to rule out this is ectopic pregnancy or the normal pregnancy. Otherwise, if they have fresh blood, we have to go to see ultrasound and check how's there is a subhematoma hemorrhagic area there or no, or there's other condition. If there's a fresh bleeding, this will be different condition. We have to be very conscious about this fresh bleeding when they have fresh or blood clots. So we have to see the ultrasound or with the confirm with the ICT if there is going to be about the patient or the situation. The breast tenderness is very common. Different kind of, as I said, the vaginal discharge and fatigue, tiredness, and the low HP, and we call the anemic. patients. Exercise during the pregnancy. Yes, this is very, very important. And many times I ask the patients, please don't think you are pregnant and then you are pregnant, but like you will not do the exercise. No, you have to do the exercise. At least you have to do like a stretch exercise. I will show the later on what kind of the exercise you have to do is. For example, you have to do the always warm up before the exercising and cool down afterward. Try to keep active and daily basis. 30 minutes of walking each day can be enough for you. But if you cannot manage that, any amount is better than nothing. Like avoid any strenuous exercise in the hot weather. So you have to go to the mall and then you have to do the walking at least there about the hot weather. And you have some nearby your house. If you have enough area, you can walk in your home as well. Drink plenty of water or other fluids. If you don't like the water because you have a nausea or vomiting, so you can go ahead with the juices, milk. You have to increase your fluid intake. Water always, I ask my patient at least 2 or 3 liters you have to drink every day. So you will keep your other kind of the infections or UTI, urinary infections in the pregnancy. And then you will hydrate it more and more. Do the stretch exercise. So what kind of the stretch exercise you can do it? This is very easy and very nice exercise I will share here. Mostly my patients that coming, I show them what kind of exercise they have to do. This is very easy. They will not harm to your baby anyways. But in case if you have a fresh bleeding or light bleeding, of course you will not do that from here many kind of exercise. But mild, the first time you see here, you can do this exercise with the mild spotting as well, but try to avoid as much as you can. Like I don't want any patient like they have a spotting and they will go for the repetition of exercise and then have other cramps or other pains in the abdomen. What kind of the exercise you have to avoid during the pregnancy? Do not lie flat on your back for long periods, particularly after the 16 weeks of the pregnancy, because the weight of your bone pressure on the main blood vessels bringing blood back to your heart, and this can make you feel fat. Do not take part in contact sports where there is a risk of being hit, such as the kickboxing, judo, or squash. That will be help such as the affecting of course with the baby condition. Do not go the scuba diving. This will be because the baby has no protection against the decompression, sickness, and gas embolism or the gas bubbles in the bloodstreams. Do not do the exercise like at a height over the 2,500 meters above the sea levels. Nutrition and diet. This is a very common question all the patients ask us. So we have to maintain the healthy pregnancy diet, approximately 300 extra calories per day. These calories should be come from the balanced diet of protein, fruits, vegetables, and whole grains. Sweets and fats should be kept to a minimum amount. Healthy, well-balanced diet can also help to reduce some pregnancy symptoms like nausea and constipation. Don't make your stomach empty more than 6 hours or 4 hours because you will start more acidity because your stomach is empty always. So you have to keep eating every 2 hours, 4 hours, like some snacks and healthy foods. So you will keep empty full your stomach. Eating safety during the pregnancy. Yes, you have to enjoy your meal always in the first 3 months. Don't think you are sick, you have a nausea, you have vomiting. At least you will eat something and you will give some energy to your body. So you can go ahead with the vegetables, you can go ahead with some fruits, grains, and then dairy products like yogurt will help you to reduce your salivation. And the protein, different kind of the protein is in the nuts and then eggs. Food to avoid during the pregnancy, this is very important. You have to be sure about your diet, what you're going to take. Unpasteurized milk, this is like, it's uncooked milk and foods made with unpasteurized milk, like soft cheese, including the feta, the Blanco, Frasco, or the berry and blue wine cheese. This is, you have to be avoid as much as you can. Unpasteurized juices as well. Hot dogs and luncheons meals unless they are heat until the steaming hot before the serving. Raw and uncooked food like egg, meat. Do not use the sushi too much in these days. Cooked sushi is enough to eat for you in the first 3 months. But uncooked sushi you have to avoid it. Refrigerator, fat and meat space you have to avoid it. Canned food like tuna, fish. This is also very because they have a high level of the mercury in the food, and there are chances for the abortion of the repeated abortion of the baby. So you have to avoid this kind of avoid too much caffeine, avoid the smoking or the cigarette, and avoid the alcohol as well. This chart we give is very nice and easy for you, everyone. You can take the screenshot as well, because this is very healthy and easy to help you to take every day, like you have to go for the which is good for you and which is not. So lentils is very nice and healthy, carrots, quinoa, and leafy vegetable, avocado, and dairy products. What you are not you have to avoid, like raw first food, undercooked meat, as I said, unfresh dairy products, processed junk food, uncooked fish, and peanuts. They make the allergy of the baby in the early first few years. So you have to avoid. Traveling during the pregnancy, this is very common question. Many times we see from the patients. Yes, you can travel actually in the first 3 months, but it depends on the condition. For example, if you are traveling during the pregnancy and you have a spotting and you have a cramps and you have a lower abdominal pain and you have other kind of the high-risk pregnancy, so we always advise the patient don't to travel another 3 months until your baby will be viable and grow up in the proper way. If everything's fine, they have urgency to go for the traveling, yes, you should go. There is no harmful for the pregnancy and you don't have any high risk. Sex life during the pregnancy, you can do it actually, but the thing is depend on the condition again. If someone have with a spotting and bleeding and then other disorders, so we have to ask them, yes, you can make a break like 2 weeks or 3 weeks. When we see the ultrasound and we see there is a contraction, during the scan we can find it, so we have to ask them, do you have to break like or the bleeding, so you have to break like 1 week, 2 weeks until the baby will settle down. Handling discomfort, wash, rinse all raw produce thoroughly under the running water, tap water before eating and cutting and cooking, because many patients, when you bring your vegetables and fruits and you're washing very quickly and then you start to eat, now you have to wash properly because there is many kind of the bacteria out there, and then you will start some kind of the stomach pain and loose motions. So you have to avoid these things, and clean is you wash your hand before you handling your food. And then wash the vegetable, as I said, and properly when you start to eat. Cook the beef or the chicken or the fish. You have to be proper in the internal temperature, 25 foot thermometer. Chill properly, refrigerator all the pre-shareable foods. Remember to always wash your fruits and vegetables. So as I said, they get rid of the harmful bacteria. What you have to do and what not. Skip the coffee as much as you can, like 12-ounce cup of the coffee a day is preferably fine. So we usually tell the people to wait until after the first trimester. But if you are really craving for the coffee, you can take it less than half cup, like for 2 sips as you like it. The hair dye or the hydrofacial and the laser of the hair removal. As we advise, as American College of Obstetric and Gynecologist, they advise you have to avoid until 3 months for these conditions, because the hair dye, they have many kind of the chemicals. They will go from your, you can inhale this actually the smell of this dye, and then you will give to the baby as well, because of the when you apply in the hair color in the hairs, there is a small capillaries in the body. So this will reach to the baby with the blood vessels, and then it will harm to the baby. So you have to avoid these things at least 3 months early pregnancy. Say no to fish. Fish that have no level of the mercury, as I say, tilapia, salmon, or actually it's very good. Salmon is just very good for the women during the pregnancy. If they have a high kind of the omega-3 fatty acids, so it's good for you and for your baby. So it means the normal fish, you can take it like 2 to 3 times per week. Skipping the raw sushi, as I said, yes, you have to be, for example, the mackerel, shark, or jellyfish. Many people they like to eat. You have to avoid this fish as well. No hot bath, yes, it's fine to take the bath, but not like too much hot. As I said, like 102 degree of the temperature Fahrenheit, you have to avoid, because the temperature is high, dangerous for both for you and for your baby. And then the mental and emotional health, this is very important, and we see some patients and they have expression feelings like the combination of the physical, social, and emotional changing in the pregnancy for some lead to the mental health issues, such as the anxiety, depression. Sometimes it's because of some personal issues, or maybe they are emotionally, they have depression, many other things. So you have to try to avoid as much as you can, but there is a treatment for the depression, anxiety, eating disorder, and stress during the pregnancy, and we can manage with the patients easily. Managing the high risk of the pregnancy, most commonly this high risk of the pregnancy, we can find it, for example, as I said, the 3 months is very important to do the ultrasound. We had to reconfirm like intrauterine pregnancy should be there. Many times when we see there is empty the uterine sac, when we see the beta HCG like it's 6 weeks or 7 weeks, but there is no, for example, in the 5 weeks, we should see the gestation sac in the intrauterine pregnancy, but in case if we cannot see, so that means we have to recheck again with the both side of the ovaries. Maybe there is a pregnancy is growing in the ovaries or tubes. So we call like ectopic pregnancy. These symptoms like some patients when they see the beta HCG, it will be really high level of the beta HCG, and when we go for the ultrasound, we found there is no intrauterine pregnancy, and we can find in the ovaries, in one of the ovaries there is a pregnancy. There is chances for the repeated ectopic pregnancy as well, but we have to be ruled out with to compare with the beta HCG is more reliable when we cannot see. Even sometimes it's very tiny pregnancy in the tubes, so we cannot find it. So we have to be compared with the beta HCG again. The gestation is diabetic. Some patient already knows they are diabetic and they are taking the insulin or glucophage. So we have to be very carefully monitoring in the 3 months. We have to do with the officially the blood test. And already they are taking some the endocrine test with the diabetic treatment. Hypertension in the pregnancy. Many patients, when they compare, we have a severe headache and there are vision in the front of the eye. So we have to be keep in mind. We have to check with them like protein albumin in the urine, and we have to check, advise them to check like at least 2 or 3 times a day the blood pressure, or nearby if they have a health center, whenever they have headache, they have to go to check the blood pressure and consult the doctor. Thyroid disorder is very important, and we do the early screening test like in the pregnancy. We are doing the thyroid test as well. If someone have a high level of the thyroid, we have to get them the medication to start accordingly, and then we have to repeat after 1 month or maybe 3 months. Cardiac disease with the pregnancy. This also is very important and very high risk pregnancy. Multiple sclerosis, like they have many patients will come to us, they have a multiple sclerosis. This also kind of disease for the skeletal pain and muscle pain and the body. Fibroid uterus, as I said, there is, we have to check during the scanning the first 3 months. We can see very clearly the uterus, the uterine fibroid, if they have one or multiple, and size and site as well. The kidney disease, obesity, the clotting disorder, birth defects, if they have previous histories, multiple gestation like twin or triplets, or preeclampsia and other symptoms. So mostly, actually, we don't check in the private hospital this iris, and we manage in our clinic, and then we have to refer to them like in the government hospitals for the further delivery process and treatment. The bleeding, about 25% of the pregnant women have a slight bleeding during the first trimester, as I said before, like light spotting, maybe sign that fertilized embryo has been implanted in the uterus. But if you have a severe bleeding, cramping, and sharp pain, you have to consult your doctor. This could be a sign of the miscarriage or ectopic pregnancy, as I said in the beginning. Cause of the bleeding is very common. You have to know everyone. This is like ectopic pregnancy and molar pregnancy we can find in the early 3 months of miscarriages. Or later on, we can exclude like the placenta previa, placenta preta, placenta brachio, preterm labor, or time rupture. This is very serious conditions in the bleeding disorders. Medication is very important. Yes, we have to give 3 months, every 3 months, we have to give them like folic acid. You have to take the folic acid like 5 milligram. This is very important to prevent the neural tube defect of the baby or the brain abnormalities. So rather than you are taking many multivitamins, take it only 1 folic acid, single dose every day until the 12 weeks. And you have to take it prescribed by your doctor, like the multiple medications. Multivitamins or omega is very important. Calciums, we are giving the patient after 12 weeks of the pregnancy. We are giving antibiotic, many antibiotics in the vomiting. It's very, to treat the patient with the hyperemesis, like with the vomiting and nausea. The Parental advance is safe in the pregnancy. Many patients are asking us, I have a headache, I have a body pain, yes, we have to take it. Vitamin D is very important. You have to take if you have a body ache in your vitamin D, so you can take it safe in the pregnancy. And then other kind of iron is depend on the level of the hemoglobin, so we have to prescribe for the patients. So thank you so much for and Ms. Leslie. Now you have to be talk further.
So thank you everyone for staying with us. Dr. Shaista will answer the questions in the end. Okay. Just we want to present to you our special offer for those who attended this workshop. Okay. So this is our antenatal package for the full trimester. So if you take this package, you will get free 4D ultrasound scan, okay, with the CD and with the picture as well in a nice frame. So this offer is exclusive only for those who participated in this webinar. Another offer we have is the antenatal package, and if you book the delivery here, either normal delivery or the cesarean delivery, you will get 10% off, extra 10% off. All right. So antenatal package plus normal delivery or cesarean delivery, you will get 10% extra. So these are our VIP rooms. Just showing you how it looks. If you want to upgrade to VIP rooms. Okay, so other services we have for pregnant women, actually this is post-pregnancy care. We also have a special massage, post-delivery treatment. And this is available in our Head and Salmabad branch. So the numbers are there. If you want to book this offer, you can just call that number. Other services or other offers that currently running in our hospital is the cervical screening package, which is 30 BD. So this you can book with Dr. Shaista and Dr. Saha. Another one is the PCOD screening package, which is 25 BD. The numbers are there. If you want to book an appointment for this, you can just call or WhatsApp that number. So now, back to Dr. Shaista for the question and answer.
Yes, please feel free to ask any question if you have. Yeah, there is a question where someone said like if there is a blood group is O negative and I have to take a test or a shoot, so my baby will be okay. It is correct, it's something not necessary. See, during the antenatal, yes, we have to see the blood group, as I said, is very important for us. So when you have a blood group negative, many patients already they know when they have blood group negative, we have to do the NTT blood test, but to confirm she is O negative and the antibody is present. So we have to give them the shoot like in the pregnancy. Sometimes we depend on the condition we are giving. If she have in the early pregnancy, the spotting, we have to give in the early trimesters like the first dose and then later on in the second dose. After the pregnancy, we have to check with the baby blood group. If it's coming the positive, so we have to give again the one more shoot. But in case this will be help to prevent the coming pregnancy. Many times when we see we are giving this, some kind of the blood that we can call this, the BBC is transferred from the mother to the baby. So they have a different kind of the conditions like the preventing the infections or some other kind of the blood disorder disease. So we have to give the anti-V, but for example, this is not 100% sure you will take this injection and then coming baby will be secure and will be a negative blood group. It's not like that, but at least we have to give and we have to secure for the future of pregnancy. So it's very important for us to we have to give the second question, when is the best time to have the first scan to check on the baby at 6 weeks or even less more? See, my experience, even when we see the patient is coming to me like 4 weeks, they are saying this is a 4 week of the pregnancy, and they do this only the pregnancy test. We try to see the ultrasound, at least we have to see the gastrical sac. For example, sometimes they are not sure they said like this is our first day of the pregnancy. If we compare with the first day of the periods until the day of the arriving in our clinic, so we have to compare the date. If there are 4 weeks, of course we cannot see in the ultrasound. So we have to go always with the beta CG. As you said, the 6 weeks pregnancy, yes, we can see the 6 weeks pregnancy in the gestational set is very clearly. You don't want to go, for example, you did the beta CG or you did the pregnancy test is positive, you can wait until the 5 weeks. But in the 5 weeks, yes, we have to see the gestational set. As I said, this is very important for us to check either you have intrauterine pregnancy or in the tubes. The other question, what is the reason for the getting UTI in pregnancy and best way to cure, prevention and treatment? Please guide about the medicines to be taken in the UTI. See, many common infections, the women that have like vaginal infection, urinary tract infection, there's a different reasons because once you're pregnant, all the hormone of the body is changed, okay? But the UTI is coming from maybe from your partner, or maybe you're using the toilet, the already infected. This is a way to get the infection, even vaginal infection or the urine infection. Or some patients are giving us the history. We have repeated infection on and off, and then we have to, if they are coming with the pain in the kidney area, we have to advise them to do the kidney ultrasound and bladder ultrasound. So we have to rule out during the pregnancy if she has any stone or other things. If no, generally or normal urinary infections, yes, we have to give. For example, if you do the urine analysis like general routine test of the urine, you have some bacteria plus and the leukocyte is positive, so we have to advise them, the patient, to go for the urine culture. And this urine culture is like after 3 days is coming the report, and this urine culture will show you have what kind of the bacteria you have. Either you need to be treated like with antibiotic or no. But most commonly, we give the prevention for the symptoms like you have burning of the urine or lower double pain, and then you pass the urine and you feel you have difficulty passing the urine or pain passing the urine. You can take the cranberry sachet or remix tablet is available in the market, not the juice. The pharmacy available the medicine and sachet. It is very good. 2 times a day you have to take it for 2 weeks, and it will relieve your symptoms as well. The other question, when is the best time to have the first scan to check on the baby at 6 feet or this is already given the answer, I think, yes. The other question, is there any kind of the medication to take avoid the miscarriage after 2 miscarriages? Yes. Yes, we are trying our best to give the medications like the progesterone medications. We are giving the oral tablet, we are giving the injections. We are advising patients once you confirm you are pregnant, so you have to take the folic acid. We are giving, as I said, the aspirin sometimes if needed according to the condition, and sometimes we are giving the injection and general suppositories as well. It is okay. The other question said it's okay to take the vitamin D tablet 50,000. Yes, you can take it, no issue at all. Because mostly we prescribe like 1,000 daily. It's your choice. You want to easy for yourself, like already you're taking many medications in the pregnancy, so you can take 50,000 international units. It's not milligram, it's international units. You have to take once a week for 12 weeks only. One more question. So I am 5 weeks now. I have to check. Yes, you have to go to check. At least you will be relaxed. Your doctor will be relaxed, like you are 5 weeks of the pregnant, and pregnancy will be intrauterine. This is very important. In case if we cannot see in ultrasound for the 5 weeks, so we have to go with the beta CG to reconfirm with your date of the periods, like the 5 weeks, and with the beta CG to compare with the both blood test. It should be the equivalent to the dates. If it's coming like less, so you have to wait like 10 days more or 2 weeks more, so it will become like appearing in the ultrasound. It is safe to do the yoga exercise while we do nothing before pregnancy. Yes, the yoga exercise is fine. You can do it. At least you can do the stretch exercise, and this is very relaxing. You will, after the yoga, you will relax your mind, and you will be very fine, like comfort, and easy for you to be more relaxed on the day. You will feel more relaxation. Of course, the yoga is very nice. One more question. There is any test for the pregnant in the first 12 weeks? There is any test for the pregnant? What do you mean? Test for pregnant at Can you clear send me that question? What type of the test you are saying? We have many tests actually. In the 3 months, yes, we are doing all the screen tests, as I said, like blood group, CBC, hepatitis B, hepatitis C, HIV, VGRL, thalassemia. There is all the list up here in the first 3 months. We had to rule out like rubella. This is all very important blood tests we have to do. One more question. I'm checking prenatal vitamins. Is there any else I can add to check this also? If you are under 3 months of the pregnancy, prenatal origin is more better to take it. Prenatal max we have to take later on after the 3 months, because this prenatal max, they have omega and multivitamin. Is more better to take after the 3 months. Prenatal origin you can take it in the first 3 months. Yes. One more question. I'm checking folic acid 1 ml and no other medicines and vitamin is enough for me. I'm not being pregnant. If your first pregnancy, this is the one. Folic acid 1 milligram is okay for you. No any harmful. At least you're taking then nothing. So better to take prenatal origin is will help you a lot. So thank you so much. If you have more questions, please you have our number. You can send us the WhatsApp, and then thank you so much for you, and we'll see you soon.